We fix tennis elbow every single week. We get new cases. I want to show you exactly what to do at home. This will work if you stay consistent with it. This can be a really irritating injury. So let's get right into the exercises. First thing we have to do, we need to roll out our extensor. So we get up against the wall. I'm gonna put this ball against the wall, and then I'm gonna push my rib cage into my elbow and my forearm, and I'm gonna glide forward, and I'm doing flexion at the same time. So I'm loosening up the muscle tissue in the belly and the meat, right? I wanna do it for about a minute. In the meat of these muscles, because this is my extensors right here that are attaching. Please do not, this will be a counterproductive if you put the ball directly on where you're having pain. That's not gonna be helpful. Think of it like your shirt is attached right here. If it's really tight, then it's pulling all the way up here. The same thing right here, it's pulling on these attachments. If this is attached right here and I'm pulled up, now I'm getting that fraying right here. So I want to loosen up that forearm, but we have to loosen up the other side. So number 2 is that we want to work on our flexors. And the best way to do that, I'm going to grab a chair. So the best way to do that is on a table. I'm going to show you on this chair right here. But I'm gonna set this down. I'm gonna put my forearm, my flexors on top of it. I'm gonna put my hand on top of the chair, and then I'm gonna glide, I'm gonna extend my wrist each time. So I'm putting pressure down on the ball and extending my wrist. And I wanna be the same muscle belly into the meat, loosening that up. And I'm gonna do it for a minute. The biggest mistake that I see when people actually get the ball out is they do it really quick and then they're done. We need to do it for a minute. We got to really knead out that tissue, loosen that up. And we have to do it on both sides, because if I'm tight on this side, then it's pulling on here. It's pulling that tissue. It's constantly has tension on it. So we got to loosen up the extensors, loosen up the flexors. Let's get into number 3. Number 3, we got to work on thoracic spine mobility. We've got to redistribute our stress. When we are having tennis elbow, we're doing too much with our arm. We need to get more happening through the thoracic spine with rotation and through the hips. We're going to focus on the thoracic spine because it's more detailed with the hips. So we need to open up mobility through the thoracic spine, so we get this double across balls. We put it right here on the thoracic spine. We've got to loosen that up. This is the best way. So here's spot number 1, spot number 2, spot number 3. So I'm going to lay down on the ground, and I'm going to just lay back where the balls are directly on the muscles, and my spine doesn't have any compression on it. My knees are bent. Put my arms over my head and relax. So I just breathe and relax. I want to take 5 breaths right there. You can put your arms on your chest. You can have them up like this. If anything bothers you, don't do it that way. We can put our hands right here. It should be uncomfortable though, laying on the double across balls. You can also roll up a towel into a cylinder position. You can lay it across your back. I'm just breathing, relaxing. 5 breaths, and then here's my 3rd spot. I like when I get to my 3rd spot, it's a little bit more intense. If I get these arms up, I can glide them up and move those muscles around and loosen that up. So I'm getting a glide with the muscles, but always focus on the breath, because I want to focus on sinking down into the double across balls. So that one's number 3. Now, don't live in pain. Hit the subscribe button. Let us know exactly what you're dealing with. We'll post videos that are specifically tailored to you, what we do here in the clinic that fixes people's problems. And so you'll get a video on exactly what you need fixed. If you leave a comment, hit the subscribe button, that's who we take care of. Okay, we opened up the thoracic spine. Now we need to do an exercise called Batman. So what I'm gonna do is I'm gonna shift my weight back, and then I'm gonna take my arms out, my palms out to the side, and I'm pulling my shoulder blades down and back, and I'm extending with my wrist. So I'm lengthening out all this muscle tissue in my arm, lengthening out and squeezing my shoulder blades down and back, my chin tucked, and I'm holding that for 30 seconds. If you feel anything in your low back, shift your butt back more and allow your chest to come down. The more I shift my low back, I can fire up my hamstrings and my glutes and take that tension out of my low back. I do not want to be here and extended through my back. Another way that you can do it, we do 2 sets of 30 seconds with that. Another way that you can do it is just laying down on a bench or on pillows. So laying down on the ground with pillows right here, I can do it. My Batman's real easy. Laying down right here, because I don't want to breathe all into the carpet. I extend chin tucked, squeezing those shoulder blades down and back, holding it for 30 seconds, and I'm extending those wrists a little bit and firing up those muscles. But I'm getting that force generation. I'm firing up the muscles up into the thoracic spine. I've opened up the tissue. Now I'm gliding. Let's get into number 5. Okay, number 5 is a big one because everybody that has a problem with elbows, they have a problem with wrist mobility. So what we want to do, it's typically wrist extension. So we have a roll and glide. It happens in opposite direction. So I'm going to take my hand right here, my arms off to my side, and I'm going to scoop and glide through the wrist right here. And I'm holding it for 30 seconds. I'm going to rest 10 seconds, and I'm going to hold it for 30 seconds. Loosening up. So I'm mobilizing my joint capsule right here. So I've got to get that mobility through the wrist, the glide through the muscles in the forearm, and then I got to get that mobility through my thoracic spine and fire up those muscles so I start getting my force generation through the thoracic spine and stop hovering around my elbow. Now we have a couple bonus exercises in this video that we would do if you were here at the clinic. It's a little bit more comprehensive. Let's get into those. Okay, these bonus exercises, we're digging out tissue, we gotta loosen it up. So I do a minute for each one. So the first one, we have this muscle called the Brachialis right here. So by loosening this up, so we glide. So it's pressure and friction. I'm loosening up this muscle. You can do this in the car. We're driving around and I'm loosening up this muscle right on the side of the arm, right in front of the humerus. And so I'm digging out this muscle for a minute, and then I'm finding like nodule, like right here, I'm gliding over a muscle. I want to glide into it and not go directly over it, wiggling it. I want to go try to get into the muscle tissue and the fascia. So I'm loosening that up. This is on that side. So what happens with tendonitis is we're getting a split. We constantly have a pull like this on that tendon, and so we really focus more down the chain, but it's important to go up the chain too because we can have some pull right there. These muscles cross the elbow and they start getting irritated. We have fascia that overlaps and holds them together. So by loosening up this brachialis, we're going to get even better outcomes in a shorter period of time. Now the bonus exercise number 2 is we're going to get into this groove right inside the bicep and right above our flexor mass right here. So it's just a little crevice right here. And so I do this in my car sometimes, just having my elbow, because even if you're not having pain, these things spark up. And if you feel that you're really tender right there, we probably need to loosen up that tissue. So I have my arm on my middle console in the car, and I'm just doing this, and I'm just gliding for a minute, just loosening that up. Majority of the time, people just aren't doing things long enough. They're just rubbing something when it hurts. If you have a clear plan of what to do, I'm going right here, loosening up that tissue. I'm loosening up the tissue here. The lacrosse ball is best. You can do it with your hand right here. The lacrosse ball helps. It's like we get a little bit of extra pressure on it. We can dig into our forearm here. Your hands are gonna get tired, right? These two are hard to do with the lacrosse ball, so it's really more efficient to do with your hand, and that's why they became bonus videos. It's things that we teach to our clients here, so you get an inside track on what we're doing. So that tendon health, we got to get the pull off of the tendon so it can cinch together, and then those fibers can heal up, and we just got to start aggravating them because we're overproducing from our elbow instead of the core of our body. So the distal is far from my midline and proximal is closer to my midline. So distal athleticism, the aiming, everything that's happening out here, catching a ball, distal athleticism comes from proximal stability. So the more stable, the more I use my thoracic spine, my hips, and my abdomen, the easier it is to do sports, but it's also, you're not gonna have as many injuries because all the injuries, overuse injuries, especially like a tendonitis and tennis elbow, come from overuse of the appendages, those distal areas. We just start using this too much because we're not getting enough from here. So every time we're fixing this, we get somebody out of pain within the first 2 weeks typically, and then we get them into a training program where we're using the abdomen, the glutes, and the hips, and the thoracic spine, and we're stabilizing, and we get power from these areas where we're pushing through the hips, and we lead with the hips. That's how you're going to keep yourself out of pain long term. So make sure you hit the subscribe button. We'll do exactly the videos that you guys are looking for. Our target is to do 2 a week. So based off the comments, that drives us forward and lets us know exactly what you guys are looking for so you can get the fix that you need. We'll see you in the next video.